السلام عليكم، يعطيكم العافية. أنا الدكتور ضياء سويدات، أخصائي الطب النووي والعلاج في النظائر المشعة. حالتنا اليوم a case of colon cancer with recent left hemicolectomy imaged by FDG PET CT scan. This is the MAP image, and we see the normal distribution, the brain activity, and we suggest and we know that this is FDG PET scan. Came for staging. There is mild bilateral tonsillar FDG activity. This is reactive associated with bilateral cervical lymph nodes with minimal FDG activity, involving the levels level 1, level bilateral level 2, level 3, and these lymph nodes bilaterally are indicative of reactive process due to this tonsillar activity. This is port cath for the chemotherapy. Regarding the mediastinal lymph nodes, no evidence of hypermetabolic mediastinal lymph nodes. Both breast tissues are normal, no evidence of FDG avid lesions. There are here bilateral axillary lymph nodes with non-significant FDG uptake and preserved fatty hilum. They are reactive in nature. We should go to the lung because we know that a lung is a common place for metastasis in cases of colon cancer. No evidence of hypermetabolic concerning nodules. We should focus on any small nodule because maybe they are beyond PET resolution, even if they don't take FDG activity, and no evidence of tiny or gross hypermetabolic nodules seen. We should focus only أيضا يعني on the liver because the liver is the first site of the metastasis in GI malignancies. No evidence of hypermetabolic concerning lesions throughout the liver. These are the areas of soft tissue thickenings in the bowel segment here and here attaching to the left kidney and posterior to the left kidney. These areas are consistent with inflammatory changes rather than residual or recurrent active disease because of the recent surgery, and this is a common finding after surgery. And patient in such cases needs follow-up after 6 to 8 weeks, and these findings will be gone inshallah. There are small areas of fatty strandings due to also the surgery. No evidence of other hypermetabolic nodules. Let's see the musculoskeletal system. No evidence of FDG avid bony lesions. As we said, we start with the brain, head and neck, chest, abdomen, pelvis. Then we go to the musculoskeletal system to see the bones, the muscles, and the subcutaneous tissues. All of them are normal. And this is our report, starting with the brain. The brain is normal, head and neck regions are normal. We should write there are mild hypermetabolic bilateral tonsillar activity associated with minimally bilateral cervical lymph nodes. No evidence of hypermetabolic nodules, hypermetabolic pulmonary nodules, or mediastinal lymph nodes. This is the abdomen and pelvis. Status post left hemicolectomy. So most recent left hemicolectomy with current areas of hypermetabolic soft tissue thickenings located in the abdominal regions and around the kidney. And this is the prominent one. Also, there are areas of fatty stranding and they are inflammatory in nature. The liver is normal. The remaining of the abdomen are normal. And this is our conclusion. Appearance of which is in favor of post-surgical inflammatory process for attention on follow-up, and no evidence of hypermetabolic concerning lesions throughout this study. And today's case is very simple and reveals the post-surgical changes in FDG PET CT scan.